And I have some introductory remarks, and so we will get started. And I'm truly delighted and honored to welcome Dr. Barbara Fallon from the University of Toronto here for Grand Rounds and to host a couple of workshops today. Before we do the land acknowledgement and I introduce Barb, I want to remind people that this is part of our PSI Visiting Scholar Series in Precision Health. I'm just going to share my screen for a moment. Hopefully everyone can see this. Can you see that?
Yes.
Okay, I'm going to put it into slideshow mode. So we give thanks to the PSI Foundation for supporting this scholar series and Dr. Fallon's visit. To remind people about PSI, this is an organization that was started way back in 1970 in Ontario to support research and education for physicians in the province. Their mission statement, it's a nonprofit physician-centered organization dedicated to improving the health of Ontarians through excellence and innovation in clinically relevant research and education, including providing support for visiting scholar series like ours. PSI has a number of funding opportunities that I know many of you have applied for over the years. And just to remind you, they have a operating grant for trainees, salary support, and community education programs. And this is a rolling enrollment, no specific submission deadline. And Jim King, Dr. Jim King is our PSI executive sponsor at CHEO. And so if you have any questions, please reach out to Jim. And I want to thank Jim for his ongoing support of this series and for providing these slides. I want to thank the PSI Visiting Scholar Committee led by H.J. Jardine, who's our Director of Research Integration and Innovation, and want to thank Dr. Andrea Evans, who suggested and invited Dr. Fallon. Ottawa is built on unceded Algonquin Anishinaabe territory. The people of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them in this land. Their culture and presence have nurtured and continue to nurture this land. CHEO also honors all First Nations, Inuit, and Métis peoples and their valuable past, present, and future contributions to this land. So now it's my distinct honor to introduce Dr. Barbara Fallon, who is the Associate Vice President for Research at the University of Toronto and a professor in the Factor Enwatash Faculty of Social Work at the University of Toronto. She holds a Canada Research Chair in Child Welfare, Tier 1. She is also appointed as an adjunct professor at the Kempe Center for the Prevention of Child Abuse and Neglect, Department of Pediatrics at the University of Colorado School of Medicine in Denver, and is cross-appointed as a professor at the Department of Pediatrics at the Hospital for Sick Children in Toronto. Professor Fallon was awarded the 2020 President's Impact Award at the University of Toronto and is a past recipient of the Canadian Child Welfare League Award for Excellence in Research. Barb has been awarded over $26 million in research grants and contracts and has over 200 peer-reviewed publications. Her research focuses on the collection and sharing of reliable, valid national and provincial data to provide an evidence-based understanding of the trajectories of children and families in the child welfare system. She is currently the principal investigator of the Ontario Incidence Study of Reported Child Abuse and Neglect and was the scientific director of the First Nations Canadian Incidence Study of Reported Child Abuse and Neglect, and the principal investigator of the OIS 2018, 2013, and 2008 studies. These studies provided a comprehensive description of the needs of children and families identified to the child welfare system, allowing for evidence-based improvements to policy and practice. Dr. Fallon's past research has helped child welfare workers and policymakers understand the use of risk assessments in child protection investigations and opportunities for early intervention and prevention for children at risk of maltreatment. Her research has also contributed to the implementation of key policy initiatives in child welfare, including differential response models and specialized intimate partner violence teams. The title of her presentation today, Connecting Research to Community, Centering Relationships. Welcome, Dr. Fallon, to the Department of Pediatrics and CHEO. Delighted to have you here.
Thank you, Dr. Berman, and thank you to the PSI Foundation. I'm honored to be here. Thank you to Dr. Evans, to HJ, who is currently helping me with my slides. He does everything, and to Alma for organizing all the logistics. I'm just thrilled to spend the day at CHEO in this very important hospital. So I think we're all set. We are going to spend an hour together talking about what I view to be fundamental to my program of research, and that is centering community in the middle of a highly quantitative program of research. I know that we talk a lot about precision medicine and the need for interventions to be suited to that individual, to have the right intervention at the right time. And I always think that part of that intervention needs to incorporate the context, the community, the environment, the geography of that individual. I'm a social worker, so certainly an ecological approach to children, to families, is one that is very familiar and comfortable for me, and I think really is one that facilitates the external validity of all of our programs of research. So I have about 4 or 5 examples that we can hopefully focus our discussion on today, and I will turn it over to my slide. I'm just going to maybe get rid of my picture so I'm not looking at myself. So okay, so I'm gonna use the mouse. So today we'll talk a little bit about child maltreatment and the socially constructed nature of child maltreatment. I always like to remind folks that child maltreatment is socially constructed. Certainly all act to ensure that children thrive, that no harm comes to them. But when we act and how we act certainly is something that I'm constantly interrogating. It's always in the purview of a formal child welfare response. I'll tell you a little bit about how post-positives like me became a community engaged researcher. I view myself as a community engaged researcher. I'm always very careful not to assign labels to myself, ally or community engaged researcher, because for some folks I'm not. So it's something that I desire to be, but I really am very hesitant to label myself as anything that remotely resembles helpful until other people deem me to be. As I said, we'll go through about 4 or 5 examples of community engaged research partnerships, some of the things that we did well, some of the things that we didn't do well, talk about what community partners need from researchers, and I'm hoping that there's lots of time for discussion. Okay, HJ can sit down. I've managed to operate the slides by myself. So just begin with the duty to report, and I know it's familiar to many people who've attended this presentation. The Ontario Child and Youth Services Act sets out reasonable grounds for a call to the society in Ontario, where anyone who suspects that a child has either experienced some type of maltreatment or will reasonably experience some type of maltreatment has a duty to report. There's, of course, folks that work with children, healthcare providers have a specific duty, but all members of the Ontario public have a specific duty to report. And I put this very wordy section on the slide because I just call attention to the tense. So it's really about what has happened or what could happen or what might happen that might involve harm or might involve risk, or the kind of milieu of tenses and constructs, I think, is an important reminder that when this instruction gets translated into regulations, into policy, into practice, that sometimes it's very challenging to remind ourselves what it is that we do. The Ontario, the child welfare landscape in Canada has 13 separate pieces of legislation for the territories and the provinces, and now Bill C-92, which is an act which was enacted in 2020, where First Nations Métis peoples can use Bill C-92 to exercise jurisdiction for the provision of child well-being services to their communities. But although there are several pieces of legislation that govern child welfare, the tenets really are similar, whereas the societal responsibility to protect children and ensure their safety and to promote their well-being, improving family function. So that is certainly a tension that you'll see very evident in some of the examples that I'm going to show you. The Ontario Child Welfare System, the latest data that we have is that we investigate about 6.5% of children 0 to 15 years of age. In 2018, the Act was amended to include visas or investigations where 16 and 17-year-olds could voluntarily call a society and ask for assistance. And we investigate about 3.5% of 16 and 17-year-olds. The Quebec child welfare system investigates about less than 2%. So one of the reasons I like this slide is that the interpretations of the system's response, even in provinces as large as Quebec and Ontario, are very, very different. 6.5% of the population, less than 2% of the population. So I'm going to need probably some help from my folks at CHEO, who now I call my friends and colleagues, but I'm wondering if people could, when I ask about these scenarios, if people could please just raise their hands about whether or not you would think that you have the duty to report to a society if you came across one of these circumstances in your practice or in the community. So a 10-year-old boy reports that his parents threatened to shoot him when he did that. Let's just see if I can see both. I think so. Andrea and HJ can tell me how many hands are up. Okay. 7. Okay. An 11-year-old boy is playing with weapons unsupervised. There are unsafe housing conditions, broken glass, flammable materials, and his 14-year-old sister was locked in a garage. Lots of hands? Yeah. Oh, no. Okay. The next one is a relative called to report physical altercation between father and his sister in front of a 7-year-old child. The child tried to intervene and was pushed. Okay. Not everybody? Okay. The next one is a 10-year-old boy is left in a parking lot. The bystander found him and returned him to his parents, who had not realized that the child was missing for 4 hours. Is anyone going to call a society about that? Lots of folks? Okay. Okay. And the last one is a school call to report that siblings aged 14 and 17 were engaged with strangers on the internet who professed sexual fetishes. All the hands for me. Okay, so Andrea Evans, thank you. As always, you're amazing. So would it surprise anyone to know that these sentences are actually summaries of episodes of Modern Family? So they are. During COVID, I asked research assistant to watch episodes of Modern Family and to look at the constructs of maltreatment, which are portrayed in the very white, middle class, loving, humorous families in Modern Family, and the juxtaposition of when you pull out just these contexts, look at the duty to report without the ability to assess those protective factors, the context where these incidents happened, is something that I really would like to do this exercise, because it really reminds folks that maltreatment is a socially constructed concept. And So often I learn and am engaged by what is our national treasure, Dr. Cindy Blackstock. And I love this quotation from her. She says, so often in child welfare, we codify the wrongdoing at the level of the parent, says Dr. Cindy Blackstock, who's a professor at McGill School of Social Work, and I think also a resident of Ottawa. And I will hold parents' feet to the fire for things they can change. But in so many cases, it's actually things beyond their control. This type of data allows us to push for change at those systemic levels, often held within government policies and legislation. And I like this quotation because she asks that we not codify things that parents have no control over and ask them to be accountable and responsible. Situations, and I know that the amazing clinician scientists here at CHEO often come across situations of medical neglect. The responsibility really has to be a broader one than that individual parent, that child. And I always challenge folks to think that if we continue to codify and to hold individuals accountable for their circumstances, then systems change becomes very challenging. And certainly, maybe some of you are practicing in child welfare, it's really a challenging job. We have many responsibilities for children, without necessarily the levers to get children and families what they need. And in child welfare, the challenges are over-inclusion. So in Ontario, we have a very high false positive rate. In investigating about 6.5% of the population, we have a false positive rate of 50–60%. We're pretty good at sensitivity because we investigate 6.5% of the population. And what is the cost then if we over-include folks in an effort never to under-include a child? And certainly these are the children who stay with us. These are the children who suffered harm or death at the hands of a caregiver, and has had some interaction with the child protection system, and we were unable to detect that from a situation that probably looked very similar to a lot of families who are struggling with significant challenges. So the society really asks us not to over-include and certainly never to miss a child who needs protection. Certainly capacity is a topic of conversation across the field, across the country, across child welfare systems. What does good training look like given the emerging needs of families and children, the intersection of mental health, of addictions, of poverty, and what do interventions look like that can really be efficacious in response to those kinds of needs. The service orientation, particularly in child welfare, and for those of you who are students of the literature, we really see the kind of swing from child safety to family preservation and back again, really driven by the tension between over-inclusion, under-inclusion, and then how to deliver services to families and children in ways that are compliant with regulations, with the legislation, but still are meeting the needs of families and children. And so I think it's an animated slide. Let's see if it will work. Okay, good. Thank you. So these are the incident studies that we've done. So I work in the best way with people that I've known for 30 years and hopefully centered in community to do national and provincial incident studies. Andrea Evans has very kindly agreed to be an investigator for the 2023 cycle of the Ontario Incident Study. In 1993, Dr. Nico Trocme, who was then a very new professor, was very frustrated that what we knew about child welfare services really came from the American literature, that in Canada, he couldn't find a number for how many children were referred to child welfare services, for what, and what did we do with respect to these positions, and sort of borrowed liberally from the National Incident Study in the States and conducted the first 1993 Ontario Incident Study. The Government of Canada conducted a feasibility study using that methodology, and in 1998, the first Canadian incident study happened, and again in 2003, again in 2008, and then we're through some complicated structure, which I'll tend to a little bit later in my presentation. The First Nations Canadian Incident Study was in 2000. And within that, Ontario has always done these 5-year cross-sectional trend studies. So they have now what will be 7 years of Ontario provincial data to look at the front end of the child welfare system. So who's referred for what do we do, and whether or not there's a placement. So between 1990 and 2003, we, as researchers, we were feeling very proud of ourselves. We've done the first Canadian incident study. We established these inaugural metrics for child welfare systems, and we were presenting it at a conference in Cornwall. I'm not sure which direction I'm pointing, but towards Cornwall, where we first met Dr. Cindy Blackstock, who was speaking, I think, maybe before us, which was always never a good thing. Do not ever follow Cindy Blackstock. But what she said to us in the year 2000, when we presented our data, was this: those are our children. And she described the impact of residential schools, 60 schools, the impact of colonialism, the devastation it had brought to nations, communities. And she, as she was talking, I really felt a wave of guilt around my own ignorance as a Canadian, around my own ignorance as a researcher. And then she said this sentence, which has been so formative to me, which is, I don't want your guilt. She said she wasn't looking at me, but I think she was. I don't want your guilt, because I don't have a poker face, but I want you to do something. And so in that sentence, I think we all have moments in our careers where we really kind of encapsulate a transitioning point. And for me, that sentence, I want you to do something. And sometimes what I do is wrong, and sometimes what I do is not helpful. But I want to do something that really begins to chip away at structures that are so harmful to children and to. And so these are the kinds of tenets that I think about in our program of research. And again, I say our program of research because I work with researchers who across the country, and of course now Andrea. I work with doctoral students and MSW students that come out of the lab. The incident studies, we always refer to them as the Hotel California of studies, because you can check out anytime you like, but you can never leave. So we really have a team of folks around us that have been supporting this work for decades. So, but in doing so, I think we've become clear about the principles that we must adhere to. The first is that the process has to be defined by equity and collaboration. And if you do that well, you will not be in control. That's a challenging thing for a researcher to hear. The posing and refinement of research questions in response to the data, which is typical investigator-driven, combined with a participatory approach, means that the utilization of the knowledge generated really is rooted in questions that matter. And so again, this is not something that happens quickly. It really is done where you have to assume that what people bring to the table is as important, and therefore if you don't understand something, you're asking your partner to explain, to help. And if you have, in this case, research methodology expertise, then you have to level set. You have to bring folks to the table where everybody has equal access to the information so that they're able to make decisions collaboratively, really collaboratively, co-creating the work and the questions. So that's sort of similar with necessary analytical skills, better position to set sustainable research priorities. And that a partnership is about a shared vision and common goals. And you'll see sometimes where we did that well, sometimes we're doing that well. I am most comfortable at a community organization or agency or listening to the worker describe the very difficult and important work. And you as a researcher really have to put yourself in those situations where you are listening. So if you're talking, and I'm conscious that I'm going to talk at folks for 4 hours today, but I always say, if you're talking, you're not learning. So be judicious about when you speak, because you're not receiving information if you're giving. And then the successful partnerships really must be reciprocal. And Again, maybe obviously I put better examples about reciprocity in the presentation. So the First Nations Community Incident Study, which happened in 2019, really was in response to the TRC calls for action, the data pieces of it, and it read, we call upon the federal, provincial, territorial, First Nations, Métis, Inuit governments to commit to reducing the number of First Nations, Métis, Inuit children in care by monitoring, assessing neglect investigations, and providing adequate resources to enable First Nations, Métis, Inuit communities and First child welfare organizations to keep First Nations, Métis, Inuit families together where it is safe to do so, and to keep children in socially appropriate environments regardless of where they reside. We call upon the federal government in collaboration with the provinces and territories to prepare and publish annual reports on the number of First Nations, Inuit, and Métis who are in care with non-Aboriginal children, as well as reasons for apprehension, the total spending and prevention of care and services by child welfare agencies, and the effectiveness of various interventions. So we as collectively as a society have done a horrible job at responding to calls to action. And in 2019, through a contribution agreement from the Public Health Agency of Canada to the Assembly of First Nations, and with the instruction of the First Nations Advisory Committee, our research team conducted the First Nations Canadian Incident Study. The aim of the study was to respond to the calls to action, to ensure that these data had appropriate contextualization of findings. And that's something we've heard very clearly from our advisory committee, that we were not to present these data unpacked. So talk about precision. So unpacked from the context of colonialism, of genocide, of residential schools, of the 60s school, that the differences between First Nations children and non-First Nations children or non-Indigenous children were really only understood within that context. That the researchers were obligated to disseminate the research results to First Nations communities, and that we needed to think very clearly about our principles. So for most First Nations communities, all of us are obligated to think about how we are articulating in our research, how we own, control, access, and possess the data with First Nations. So the First Nations folks have to own, control, access, and possess the data, and your study has to get to be able to articulate the design in ways that those principles are meaningfully thought through and executed against. Now, I always say we can do better and better at incorporating these principles into research design. We think we did a pretty good job, but we can always do better. And so this is in 2019, it was a very complicated methodology. So 2019, essentially, incident studies are done through a 3-month case selection period, October, November, December. For this data collection effort, Ontario went first, and then we went to the rest of Canada. In Quebec, there was a very high-profile case, and so they did not permit research to continue, and so we had to pull the data administratively and match where we could. And then we did primary data collection in the rest of Canada in 2019, but because an investigation period is roughly 45 days, we were really collecting, most of the data in February and March of 2020. Why do you say that? Sounds familiar? Yes, during COVID. And so the result was we had our amazing folks at Statistics Canada were incredible at helping us to both clear that our sampling drain, and then in 2019 to weight the data differently than we had, so that our coefficients of variations, or how confident we are in our estimates, were actually, although it was this very complicated kind of methodology, were actually far lower than any other incident study. And I will tell you that in Canada, In 2019, there were just under 300,000 children, 0 to 15 years of age. So we do have older children, but they're in comparable studies. We wanted to, we excluded 16 and 17-year-olds for the purpose of these analyses, and just under 46,000 children for First Nations children. So we have OCAP, we have an advisory council for this data with some of your First Nations. So, and we have data for Inuit children that we don't have any governance structure. So we've never published the data because we need a community partner too. So that's when you see some of the results. It is a First Nations child welfare investigation or child maltreatment investigation compared to a non-Indigenous. So these are the people that are members of our advisory committee and our research team. Of course, there are people that were integral to the study being done. Well, our advisory committee I would say they're our boss. So they gave the research team the instructions of everything from the standard frame to the enlistment process to the items on the data collection form, and I would say most importantly to what data were released first and what was the plan for secondary data. So in keeping with my commitment, I will just remind people that before I show you some of the data, the historical context, of course, is that residential schools were forced assimilation of First Nations people into a colonial society. And then in child welfare, by the 1950s, provincial and territorial child welfare systems are extending their services to unreserved communities, and we see the resultant market overrepresentation of First Nations children. And so these data really represent trauma, colonialism, racism, and it's replicated at individual, family, community, and intergenerational. We use census data for identity. There are terrible categories for anyone's identity. The community partners want us to be able to provide data around disproportionality and disparity. And so if we need a population number, then we have to use census data. So I'll just give that caveat, and you can see that there are very complicated kinds of intersections with the child welfare system. So these are the x-axis is white children, and then for using census categories, we look at the disparities for ethno-racial categories for investigated children. And so we work with First Nations partners, certainly we've made available the needs and Inuit data to not publicly, but to partners that have asked us for it. We work with One Vision, One Voice, who is doing amazing work around the investigation of Black children and families in Ontario. We work with a group of Latin American scholars who brought up CHEO to look at the overrepresentation of Latin American children. We really are committed to not talking about anybody's children unless we do so in partnership with clear instructions. So I think this is a slide that I've probably spoken to a number of times, but it's really it should be very difficult for everyone on this call, because in Canada in 2019, after the TRC and the growing awareness of what colonialism has done to First Nations children, was a call to action in 2015, and with very little other data that is responsive to those calls. In Canada in 2019, First Nations child is 17 times more likely to be placed in formal out-of-home care than. This was a request of the advisory committee to look at the initial overrepresentation of staff in the step diagram for First Nations children is 3.6, it's over 3.5 times. So what we've done is to illustrate that. And then we look specifically at the maltreatment form. So again, TRC called for us to monitor reasons for investigation, focusing on neglect, and you can see, again, in the amazing words of Dr. Cindy Blackstock, who is responsible when we see educational neglect at 23-fold for investigation involving the First Nations child compared to a non-Aboriginal child. We look at things like physical neglect, medical neglect, failure to provide psychological or psychiatric treatment, and there is an exponential quality to that initial overrepresentation in schools. And then again, the disparities with respect to services positions. I presented that the investigation level workers are asked to have a finding of substantiation for our study, not in Ontario, but attorney's verification, whether or not that it can transfer case to ongoing child protection services, whether the person of child in out of home care, more kind, whether they make a referral for the family. And again, we see situations where there's market overrepresentation. Although if you look at the data percentage-wise, things like physical abuse and sexual abuse are very similar to non-Indigenous children. That initial overrepresentation means that First Nations children are still overrepresented. The advisory committee asked us to really think about how we presented tables. So to look at the sample with a developmental lens. So we developed these two-page dissemination products and knowledge mobilization products in response to that instruction that really were really interrogated a parameter metric for the study. This is amazing artwork that 7Gen, which is an art program at Native Child Youth, donated for the cover. So. And then for the Ontario First Nations data, we work very closely with our NASIO partner, and Amber Pro has very generously agreed to come and talk about partnerships in the next talking tour that I do here at CHEO. But Amber Pro and Jeff Schiffer were the first authors of the report, so we worked with them to use the data to reflect the First Nations Ontario situation. We worked with an elder. We worked with, again, with this amazing 7Gen youth, so we did all the art for the. So it really was a very careful process. And this just to illustrate our one Visiting Red Voice partners. We worked with them to understand the overrepresentation of Black children in Ontario on 10 tables that really were very revealing around anti-Black racism and how the system exacerbates anti-Black racism in pretty interesting ways. And then again with my colleague and friend Julia Brada to examine the overrepresentation of Black. And so I am at the University of Toronto, and I'm as the tri-councils are really expecting us to work in a very different way. There is, I think as we kind of change our approach, I think there's a worry that how do you get things in the academic literature? How do you ensure that you're meeting the metrics that the academy or the university or the hospital is expecting of you while working in this very different way where, as I mentioned, you're not in control. That's a good thing. And just to say that we have been able to get it into the literature. This was a Harkening the Modeling series that we did for child abuse and neglect, where from our First Nations partners, who specifically asked us to understand what other contributions were there from an agency level, from a geography level, that contributes to the decision to place a child in out of home care after the clinical ones were explaining the variants. So we've done this series of analyses with some different partners. So, and then and Ashley Quinn couldn't be here today, but probably gets back in the faculty of social work. Authored a paper looking at the overrepresentation of First Nations children in Ontario. So always with the First Nations advisor And then Jennifer Ma, who's a doctoral student now professor at Master, and the amazing Ken Sharp was our first agent advisor. So we try and ensure that we work in partnership with communities, even when we're doing highly academic. So this is another project that we have at the University of Toronto, Oaklands and Care Child Abuse and Neglect Data System. Right now, we exclusively work with Indigenous wellbeing agencies who we have data sharing agreements with to essentially process and return their data in response to the questions they have about communities, about their communities, about their children, about their families. So this is, for those of you who are data folks, this is an ETL, extract, transfer, load, and we have 4 different servers at the University of Toronto, and we essentially pull administrative data, process it, push it to a website so that agencies can do their queries. And I'll just speak to a couple of examples that we've had some success using this community-based approach with, I think fairly revealing data. So again, we were asked to do the impossible in child welfare. We have to protect children, we have to promote their well-being, and we have to ensure that we are putting them functioning. And so one of the things that we're able to model in the OIS data is this urgent chronic taxonomy. So given that dual mandate and given the sort of exponential increase in the number of children who are investigated in Ontario Child Welfare Services, one of the things that we were exploring is to kind of unpack the data from treatment typologies and to use a taxonomy called our urgent chronic one that is meant to reflect the responsibility to ensuring safety and promoting well-being. And we can see that when we use those, and I'm happy to talk about how we use those, but when we use this taxonomy, you can see that we have a very, very different population coming through the front door of an Ontario Child Welfare Agency in 2015 compared to 1993. 1993, about 1 in 2 investigations were from urgent protection concern. So investigations involving physical harm, all sexual abuse investigations, allegation of physical abuse or neglect of a very young child. So that's how we define it. And then arguably as important a group of families and children, what we are trying to hopefully eloquently say is that you cannot have a forensic response to a chronic family functioning potential threat to a child's development issue because it doesn't lend itself very well to a forensic investigation with respect to engagement, assessment. And one of the things that we did to illustrate this is to go back to our OPINs to say, okay, so the government of Ontario was really very, I'm trying to use the right word, it really wanted to interrogate occurrence. So how many families after being closed came back either for an invest or ongoing services. And so there's enormous variation for agencies, not like year over year, any agency looked the same, but between agencies, there was enormous variation in the recurrence rate. And so, and when there was talk about benchmarking, we said, hang on, don't benchmark something you don't understand. So we went with our partners at OPIN, so we always work in partnership with agencies when we access data. They asked us to apply this urgent chronic taxonomy. And what we found is that the system did a fantastic job at preventing the recurrence of urgent protection investigations. And what was coming back within that year were concerns around the long-term development of the child, a family that was struggling with addiction, with a mental health issue. And so that is, these are data that have been very helpful in discussions around benchmarking experience. This is what OPINs looks like. So you're an agency, you have a secure login, and you can actually use your data based on the concern. We sort of push or query all kinds of metrics into OPINs, but we've included urgent chronic. And then another product that we built out in OPINs through kind of a culmination of all of our discussions with our agency partners, our 10 answers every child welfare agency to provide. And it's essentially a product that is web-based, where we push 3 years of data the agencies want us to, including census data, allowing them to describe the service trajectory, both you can do it at a methodological level if folks really like math, or if you're talking to a community member about what a society does, you're able to say, children in our community, what portion come through our front doors, to families come back, how many families receive ongoing services, and then we move to the kind of placement to see how many children are placed, how long do they stay in family. And again, I think this is just meant to illustrate that sort of after we've worked with a community partner to really understand the validity of our work, and then we can get it into literature. Here's some examples. The more we stay the same, the more we came to more we stay the same. That was, I really was so impressed with myself around that title, because as someone that looked at this data for 30 years, oh my goodness, we say that we're modernizing and transforming, but the system looks very, very similar. The past 30 years. 10 entries, every child welfare agency wide. Again, we were able to get into literature. Just been going to see if I'm talking too much. I can't have these much. Okay. So the Fraser-Meister Institute for Policy, Fraser-Meister Institute for Policy is an initiative that Ashley Vandermorris and I lead from CHEO. And then we have an esteemed advisory committee. And again, with community in the middle, what we do then is to synthesize literature based on the community response. So it could be an NGO, it could be a government. We've done briefs for academic partners. And we essentially become very clear on the question, synthesize it in a way that is being asked for our partner, and then we put it into the environment, into the atmosphere, and folks that have asked it use it in ways that they would like to. Sometimes for advocacy, sometimes for policy, sometimes for practice. And I'll just quickly sort of walk you through some of the products. And I know that people start to be made available, and people can go on to the website to see some of the things that we've done. So certainly we work very closely with children. And now the policy ventures will become part of the Beyond Center. Certainly we work with governments and ministries, research groups and centers, Indigenous organizations, including the Martin Family Initiative and ASIO, Caring Society. We did the taxonomy that all parties agreed to for the settlement, where we were able to suggest 4 classes for the compensation categories. Using those, they asked our team, Indigenous Services, asked our team to do a review of data systems to assess whether the data that corresponded to the compensation categories were available in information systems, and just to show how it was integrated into the class and settlement. Social identification of race in Canada. Our First Nations partners came to us when for the policy bench, saying that they were worried about the instruction of the social identification of race given First Nations, Métis peoples. Was there anything in the literature that could help them engage in a discussion with the government? And so we were able to do a policy review that looked at the collection of race and identity data, clearly demonstrating that there was an underrepresentation with a social identification First Nations Métis. And so I'm just going to move on to my last example, but here are some other ones. This was done asked by the Caring Society. This was done with sick kids about the effects of school closures with Dr. Birkin and sick kids. This I think is also a sick kids related. The questions of cannabis during pregnancy. This was done with Adolescent Transformation Justice Project, looking at the adolescent neurodevelopment and implications for the. And so the last example I'll tell you about was the work we did during COVID in partnership. This is where, as researchers, we're not doing the important work that you folks at CHEO were doing. We were at home and we wanted to do something when we knew that workers weren't seeing children and families. And so the first thing we did is go to the literature. In March, at the end of March, we got this out. There was nothing, so it became very well subscribed. And then in partnership, what we decided to do was to build out a checklist where there was in April 2020, there was nothing about how to respond to children who were being served by child welfare services, what to do when we didn't have eyes on children, which were in the community. And literally with all of these folks from Quebec, from Ontario, from hospitals, from agencies, I think in New Brunswick, we designed a checklist where we first went to the OIS literature to say what are some of the expected issues that families could be facing, and then eventually what we did is to have a worker log on to kind of go to what the issue was, the caseworker that was about self-care, child in care 0 to 5. And we asked them a series of questions, and then we populated the emerging literature or response or resource with in response to their questions. So they said, yes, this is an issue for the child. Our whole team made sure that whatever was late and breaking and helpful, particularly when the instructions around COVID were changing, we populated this to the checklist, and that's what it was for. So, and that we did it because we were trying to do something that would be helpful. And now this kind of methodology has been picked up by the Child Welfare Immigration Center of Excellence for Community Resources. They really liked it because you're able to modify it as your best practices. And as I mentioned, this is by the governments of Quebec and we were able to get in. So I think I'm going to end there. I apologize if I'm maybe gone on too long, but I'm happy to have questions. Oh, 7 minutes. Okay, so I'm try.
No, that was perfect, Barbara. Thank you very much for that that walk through all of those initiatives and projects that you've been involved with. We do have some time for questions, and we've had lots of people on Grand Rounds this morning, which is great. I will point out that Barb is going to be giving a couple of workshops at CHEO today, and Rachel has put those in the chat, and those will be held at in Roger Gandon next door in room 2113, or if you're on campus, or there you can join via Zoom as well. So those will be hybrid. Questions for Barbara? You can put your question in the chat or raise your hand. Maybe I'll start while people are thinking of their questions. So, Barbara, obviously your work has focused in Ontario, though you've had a national lens, and I wonder, are you able to speak around sort of the discrepancies in different provinces around the child welfare piece, and where in Ontario where are we sitting compared to some of our provincial colleagues across the country?
Sure. So as I mentioned, we have the highest investigation rate, certainly in Canada. I would argue probably in North America, about 6.5% of children are investigated, and we have the lowest rate of children in care. So, that's something that needs to be further interrogated, but it is something that puzzles us. So we have, as I mentioned, we have a very high false positive rate. The Quebec system investigates about 2% of children, and they have a much higher rate of children in care. The data are challenging. Dr. Berman, I know that the Public Health Agency of Canada is committed now to publishing children in care statistics. As a research team, we used to call around whenever we were frustrated, we didn't have any data. We'd call around to the different systems, hire an RA, and publish those on the Child Welfare Portal, which I think is included in the slides. But again, right back to the calls to action, we don't have very good data or collected in a systematic, transparent way. In Alberta, the last time we did an incidence study, it's around 4% of the population. that are investigated. And you see, I think it's similar. So very different kind of thresholds for investigation, and the child in care rates is about 12.80 per thousand children. So about, just under 1, I think, in the latest round of data. So 1% of children are in care across Canada, but there's enormous variation within provinces around that. And the disparity between First Nations children and non-Indigenous children, which is something I know Andrea is working on, is markedly different across provinces as well.
Thank you for that answer. We do have a few hands up now. So Dr. Einboden, Rochelle. Rochelle, are you there? You're on mute if you're speaking. Oh, Rochelle's not able to unmute. Rachel, are you able to unmute Rochelle? Or Rochelle, put your question in the chat and I can read it out. Maybe we'll go to Dr. Young and then we'll come back to Rochelle. Nancy?
Hi, can you guys hear me?
Yes.
Awesome. I'm actually going to defer to Radha, who put a question in the chat, and then I'm happy to ask my question, but just want to yield to Dr. Jetty first.
Perfect. So Radha, do you want to read out your question?
Sure. I actually have a couple of questions, but I might save some of them for later today. But the first one was just, first of all, thank you so much, Barbara. This is an important topic, and I'm so glad you're able to present at a venue like this at CHEO. Do any of your incidence studies include Inuit children and Métis children? I know that you mentioned the challenge with reporting race and ethnicity, so that may be a challenge. And then the question too about data from Nunavut.
So yes, they do. The Canadian and the Ontario studies would include Inuit and Métis children. We don't publish those data because we don't have proper governance structure. So they are available for the kind of the right community partner and governance and that instruction. And then in Nunavut, our sampling frame for the incidence studies are for, the objective is to establish the incidence of reported child abuse and neglect in the year the study takes place. So I would say until 2008, every province and territory participated in it. How we stratify is another kind of conversation. It's a bit technical. So that everyone has participated in the incidence study. We don't have data specific to Nunavut. We do for the NWT, I think in 2003, where they did a universal sample of investigation. So we're able to give a territorial incidence rate.
Thank you. Maybe just one other question, and then I'll just pass it over to Nancy. What about children who are placed in, and I hazard to say voluntary, but we call it voluntary medical foster care? And this pertains primarily to children who live in rural and remote areas. We see a lot of children from Nunavut, Inuit children from Nunavut, whose parents are, asked to place them into foster care in Ottawa to receive medical care when they're medically fragile. And unfortunately, the other option is for them to move to Ottawa, to relocate to Ottawa, which for most families is almost impossible for so many reasons. So we follow all these children here in the Akalu Clinic at CHEO, and I'm just wondering if there is any research that you know of that is being done on similar populations across Canada.
So the incidence studies wouldn't necessarily be the best place to understand that pattern, although we would have data. So remember, the incidence is the front end of the study, right? So essentially, we ask folks that are newly investigated or reopened for investigation, that those are the investigations that we describe as of the knowledge frame for the study. So if a child had an open protection file and then had to move because of a situation that you described, those children would not be represented in our data. But we would be able to, the incidence study would tell you at the front end of that in 2019, we'll be able to describe it. But I think that your question sort of underscores the kind of lack of data around children and families served by child welfare services. It's a very challenging, someone who's done this for 30 years. It's very challenging. Some provinces are better at it than others. But one of our kind of sound like a broken record, but we really need cohorts of children and families to be able to describe trajectories as an important part of the decision making. So I appreciate the question, and I'm happy to brainstorm anything.
Thanks, Radha. Nancy, do you have a quick question, just because we are almost at time?
I do, and I'll be brief. Thank you so much for a wonderful presentation. My question is really about, well, I've got two, but I'm going to ask one. Customary care. So there are lots of First Nations in Ontario that are now taking control of their child welfare. Customary care is a fairly common way of managing children who need protection. How does customary care get reflected in the data?
We would have it as a category of placement. So I think it's in the Ontario, the First Nations Ontarians in study report, it would be a category of placement. So place from invest. So we would have it as a percent. Overall, placement is a very rare decision during an investigation. It's about 3% in the overall sample. Of course, it's in Ontario, it's 8-fold for First Nations children, and in Canada, it's 17-fold. And its customary care is only an Ontario placement category. But those data would exist in the FN OIS 2018.
Thank you so much.
Thanks, Nancy. And in the interest of time, we'll stop there. Barbara, Rochelle did put her question in the chat. I don't know if you're able to see it, and hopefully Rochelle will be able to join one of the workshops later. And then Christina asks if we can share some of the slides, or at least the reference list, and so we can circle back to you about that. Obviously, lots of interest in this subject across our CHEO community. So I want to extend a huge thanks again to Barbara for really an outstanding rounds, and looking forward to her workshops later this morning. The Grand Rounds evaluation link is in the chat, as are the times and links for Zoom for Barbara's workshops. And if you don't have a chance to copy them down, please reach out to our office and we can provide those to you. Again, a huge thanks to Jim King and the PSI Foundation for sponsoring today's talk and visit, and wishing everyone a great day.
Thank you.